My name is Heidi Schutz, and I am the director of the laboratory program with Heart to Heart International, and we are with Oceana Community Health here in Boynton Beach, Florida today. We were able to connect Dr. Moti to our disaster response team in light of the tornadoes that came through the area.
Good morning, my name is Dr. Moti. I'm the executive director of Oceana Community Health. And Hurricane Milton was obviously a storm that had ravished through the west coast of Florida, but what was unprecedented was a series of tornadoes that had struck various communities throughout the state, particularly our Fort Pierce community where our clinic is established. This was a community that was essentially torn through and really faced the brunt force of these hurricane category winds and tornadoes. What that meant was a degree of inaccessibility they have never experienced before. For our retirement community of Spanish Lakes, where the majority of our relief efforts have been focused, we've had individuals lose their homes, suffer the utter damage of tornado-force winds, and that's exactly why we've partnered with Heart to Heart to help tackle this issue head-on and prevent the exacerbation of previously controlled chronic disease. So the initial partnership was furnished with hygiene kits and necessary resources and basic necessities to distribute throughout the community, and now the generosity of HHI is in full display as they helped us achieve the next level, which is management of the chronic condition diabetes. To have the generosity of Heidi come in here herself and set up our laboratory not only for the patients that we're encountering in the disaster response, but for patients that we serve as a free and charitable clinic, speaks volumes to the level of involvement HHI has with its community partners.
Heart to Heart's laboratory program offers a sustainable solution for these communities. By establishing laboratory testing, we further our mission of providing sustainable, ongoing health care, increasing access to health care for not only in disaster reliefs, but people that don't have that access on a regular basis.